often, we focus on the emotional angle while taking problems in our sex lives. However, psychological problems like low sex drive, erectile dysfunction, and impotency cannot be ignored either. Today, we are honored to have Professor P. Ganeshan Adaikan to share some common challenges faced in maintaining your sexual health as you age and explain how to prevent and treat these dysfunctions. Professor Adaikan was the team lead and head of the sexual medicine section at the Department of Obstetrics and Gynecology at the Yong Loo School of Medicine, National University Hospital, and National University of Singapore, foreseeing his academic and research pursuit of staff, postgraduate students pursuing their PhD, MD, and clinical MScs. A principal investigator, he was awarded more than 10 research grants amounting to $4 million in the past 15 years, which include international industrial invitations for drug testing and clinical trials. He's currently the Secretary General of the World Association for Sexual Health and the Society of Study of Andrology and Sexology, Singapore. Through his exhaustive scientific pursuit in the area of sexual medicine, Professor Adaikan established the Male and Female Sexual Dysfunction Clinic as a part of the Andrology Unit in the OBGYN Division, National University Hospital in 1986. He has professionally led the clinic for 3 decades and also guided and trained doctors and trainees in sexual medicine. He has vast experience in treating couples and individuals suffering from sexual dysfunction and other issues related to fertility at the National University Hospital. Please put your hands for Professor Adaikan as he addresses us. Thank you.
Very good afternoon, all of you. Thanks a lot for coming, and it's a very steep stairs here, but excuse us for this, but you can see it properly in these things. I was given this title, Keep the Flame Burning. So it is something, it's hidden. The meaning is a bit hidden. Long ago, one patient came, and that time injection is given for improving erectile dysfunction. And he was impotent, and then he wanted some medications. So we give the injections, but he said he is unable to have it at home because his wife is refusing to have sex with him. And that's the time I heard the term flame. So he said he is going to use it with his old flame. So I learned that day what is old flame is. So that it reminded me when the organization gave me the title, Keep the Flame Burning. And also I put a rose flower there. It's for the love. The love and intimacy is extremely important for the couples. And I put all these things here. Mainly I'm going to touch upon as what the MC mentioned, the erectile dysfunction. But also erectile dysfunction means we are really talking about general health. As you are going to see, as I'm going the problems of erectile dysfunction and other things, you will see there are, if we are very healthy and viable, then there shouldn't be any problem with erectile dysfunction. Let me go through some of those factors now. So the sex is very important, although we are all hiding it under the carpet. We approach sexual problems and concerns from a perspective that include psychological, hormonal, medical, and couple relationship. It's a holistic treatment in this clinic at the SH group. It is not just looking at one aspect. We also provide education about sexual health. Education and knowledge about sexuality is extremely important because there's a lot of misconception hanging around, particularly in Asian context. So these are some of the things, but we also strategize to maintain the healthy sexual functioning at any age, not just the young couple, but also up to the older couples. And there was a survey done in the United States. Although 85% of the adults want to discuss sexual functioning with their doctors, but they were very shy. They were also concerned. 71% believe that their doctor does not have time for sexual problems to discuss. 68% don't want to embarrass their doctors because they felt that it is embarrassing. 76% thought no treatment was available. So these are some of the concerns the patients also will have, but some of the doctors also may not be asking a question when you are coming for something else, for a diabetic problem. Do you have any sexual problem? They also may not ask. Some of them do ask, some of them may not. So it is up to you all to be very aggressive in going to professionals to treat if you have such problem. So now coming to the men's sexual problems, I will divide that, although there are so much, but I will just give you 3 types of problems. One is erectile problem, that means the penis cannot bring up itself for engagement in sexual intercourse. Or it can come up, but then it will go down before even starting the intercourse. So that's the erection problem, few problems. Sometimes completely cannot get up at all. With all these things have to be evaluated why this happens. Then the ejaculatory problems, particularly in the young couples, those who are interested in making baby, and then looking at the ejaculatory problems. Of course, sperm, looking at the seminal analysis is one important aspect, but in relation to the sexuality, there are so many factors for ejaculation. One is premature ejaculation. That means the person will ejaculate before even engaging in sexual intercourse, and that is called severe premature ejaculation. I will detail out all these things later on. Then the delayed ejaculation, that means somebody who can have the intercourse for a long time, 20 minutes, 30 minutes, 45 minutes, still you are struggling to ejaculate. So a few times you may struggle like this, and later on you will get fed up with the sexual function and they may drift away. So these are some of the problems. Then the other thing is any ejaculation. Any ejaculation means completely cannot ejaculate. He can get a good erection, he can have a sexual intimacy, but then he cannot ejaculate. There are some general genetic factors and other factors are, but organic factors are there, but mainly it's a psychological as well. And the last one is retrograde ejaculation. Retrograde means that the semen, instead of shooting outside, may go inside. So this is some of the 3 or 4 factors of ejaculation. Then the desire and arousal. Without the desire, how to have sexual intercourse, how to have intimacy, there must be some desire. So that also we will discuss a little bit in a short while. So erection's definition is inability to attain a erections and also to maintain the erection, which is very important, sufficient for sexual performance. And invariably in the world, 10 to 25% of the men, the young men also get erectile problem. You can remember by the age, like if you are about 40 years old, the 40%, 60 years old, 60% of them may have problems. So it's an easy way of remembering that. And then erectile dysfunction is divided for us to identify and diagnose, divided into 2 components. One is the organic, that is mean biological, the system, in the system something wrong. That means like blood pressure, instead of being normal, it become abnormal and it may affect. So that's organic. Vascular mean blood vessels. Vascular mean blood vessel, then neurologic mean nerves related, hormone related, structure of the penis related, and also sometimes certain drugs when they are taking may not also work properly for them. So that is organic factor. We believe that about 80% almost everybody is having that. But nowadays, we see more and more young people in our setting, clinical setting, and most of them do have psychological factors. They are affected by psychogenic factors. I am going to detail out and explain to you how psychological one cannot get. Otherwise, he's perfectly normal person, but psychologically things won't get up. We will discuss that also. And very often, many men will have a mixture of both. In the 40s and 50s, 60s, we may have some problems here and there, disease problem, and that one plus psychological. So that is how I frame this into categories. Now I'm going to give you some details about the organic factors of erectile problem. That is why I told you earlier, if you are thinking about erectile problem, it is also a global problem for the body health. Look at all these things. hypercholesterolemia, high cholesterol level, if you have, high triglyceridemia, another oily lipids, diabetes, hypertension, blood pressure, increase of blood pressure, and heavy smoking, even limited smoking also will cause the problem. And all these things, and the lifestyle factors as well, obesity, aging, some diseases, and counterproductive to this ED. Obviously, alcohol also, too much of alcohol can create alcoholic neuropathy, nerve problems. All these factors will create organic erectile problems. Like I'm going to relate this heart, that at the top of the heart there is a small vessel called coronary vessel. If the coronary vessel is blocked by cholesterol and all these things, as you can see in the pictures on the other side, blocked, then that's what is causing the heart attack. But that coronary vessel is about 10-20 times bigger than the vessels in the penis. So one of the way to remember, ED may signal cardiovascular ailment. If somebody is getting ED suddenly in the 30s or 40s or 50s, and it is also an indication the coronary vessel also may be blocking. So in a way, it gives a signal. So both are blood vessels, the penis and the heart as well. Now you see the normal, the first tube is the coronary tube, the heart tube is normal. The last one is filled with cholesterol and then it becomes a plaque, become fibrotic plaque. That's how it happens. So one of the things is to bring down the abnormal cholesterol if we have. And psychological factor. Psychological factor is nothing to do with the biology, it's to do with the mind, the brain, what it thinks, how it fears, how it gets very scared about this. Do you know that men are all very brittle? You know, they are not very strong people when coming to sex. Most of the men is very, very fearful whether they will do it or not, whether they can do it or not. And then by the time they think about it, things will never get up. So inadequate sex knowledge. So sex knowledge also very important because misconception that and this cannot touch, it is dirty, that so many misconceptions. And also feeling guilty, very religious, I didn't want to do, sex is sin, sex is dirty. Even with the husband and wife is legally a very good intimate friendship people, and yet the man will have that same feeling. And the defense again erotic, any desire if it comes he will try to block himself away from that. So what is psychogenic ED in terms of fear of performance? Fear of performance, and then he also fear the rejection from wife. If he fails on the first night, she is going to be rejected, that's how he thinks, and then it become a big distress for him. And also fear of pregnancy. Sometime in the college when the girl and boy become friends and loving couple and they will get married after that, and then they were very young and wanted to have sex also, some of them, and then when they wanted to have sex they don't want to have a baby, so the girl will warn him there's no pregnancy, no pregnancy. So if he is fearing pregnancy and then he is thinking only that, he goes and tries his girlfriend and he is unable to get. So young men also is affected by the psychogenic problem. Then initial failure, if on the first night, in the wedding night, if they are failing and that's it, after that his worry alone, he keeps on trying, he will be failing. Severe premature ejaculation also make the person think that is important. So these are all, sexual knowledge is very important. Fear of failure, why he could not get the erections? Because when he is failing, second time he is failing, he is looking only his penis, whether it will get up or not. He is not interested in arousal, he is not interested in foreplay, he didn't want to admire his wife. All the time, you see this cartoon also saying that distraction, inattention, he is not interested in arousal, but he just wanted to see. So definitely it will not work. These are all psychological factors. Now, sometimes it's the wife's behavior, wife's trait, how the wife is perceiving this thing can also make him to go down. I give you some example. If she has no interest, no desire, if she is not taking part with him in a better way together, then his interest is gone. Things will go down. And then And then sometime if continuous abortions are there, and then things are getting bad, not so good, and eventually the husband and wife will drift. I am basing all these things on some cases that I have seen. Lubrications. Lubrication is a very important during the foreplay, wife must get some lubrication and engorgement of the private part. Without lubrication, erection is going to be very difficult, that will be painful. So some men will find it very difficult. If it's little painful, things will go down. This is all psychological factors. And excessive lubrication also, some men worries a lot. And it comes with complaints. I have dozens of men telling that it's too much lubrication. And that also they can't feel the sensation, and it will be a problem for them. Then sometime if the wife say your penis is very small, finish. After that it will never get up, because then he worries so much here that things doesn't work there. And that's, I will have a cartoon for you all for that. And then interpersonal quarrel, first 2-3 years everything is okay, then the quarrel and all things setting in, and then the drifting will start coming. So these are all psychological factors. And then traditional and shy wives, and he wants something who can, go along with him, and it's a big problem for him. And some ladies may not want the husband to touch the private part, may not want kissing. So these are factors of knowledge that we have to give them, and that's very important for us to do. And this is the problem sometimes. When it's too big also is a problem. When it is small also is a problem. So this cartoon tells that. Then male can get impotence or psychological erectile dysfunction when the wife is having some conditions. One of the things is vaginismus. Another one is dyspareunia. Vaginismus means the lady cannot accept the penis into the vagina. And the moment husband comes together, her legs will turn up tightening and all freezing, and she will get very painful if he is approaching. It's vaginismus, a condition. It's not very uncommon. And then sometimes the lady is having a lot of maternal instinct, things are not working, in-laws are pressurizing, no baby, 3 years, 4 years already. And then the normal man, 3 times a week they've been going on having sex. And if she starts pressurizing, tonight's the night, we must have sex. If she says that, he becomes impotent. Because you see the stress that men get, it's so easy for men to. So I always tell my female patients to pat the shoulder, not to worry, next time you'll be okay. Of course, for fertility purpose, we don't have to wait for the ovulation day. It's better to plan regular sex throughout the month, and certainly also that will help in getting the baby. So this is the tonight's the night syndrome, a typical example how the mind plays havoc to the man. And that day he cannot, and the flame also will die down from on that day. See, the thing is, 3-4 years he has been normal. And then when he starts failing few times, after that he become impotent. He can never do, unless he go to a professional and gets counseling, therapy, or medications to overcome this. That's powerful, is psychogenic thing. Then I give you another cartoon. See, the more he tries, the worse it becomes. He keeps on trying, it doesn't get there, it goes down. So this wife also have to be told, because wife will think that he is not in love with me, something, he is having somebody outside. These some of the things, but it is how the man is, very brittle as I say. Okay, why when he fails, what happens to him? Scientific aspect I am not going to discuss today, how this is happening, the neural pathway. Failure of lifetime, he worries. Failure of your genetic spread, you won't have babies. All these things are working on him. Now, males can also have some kind of conditions. The penis may not be straight, it may be seeing the east or seeing the west, sometime when it's erected, or going up, seeing the ceiling. It happens because it's a condition called Peyronie's disease, or it's a curvature, or it was born with that. during erection. If it is a little curve here and there, it's okay. So long as there's no pain during intercourse, it's fine. But if it's something that what you see there, it's a Peyronie's disease, it's called. The plaque is there on the side, and then it goes up. You cannot have sex. And it's a big problem. For that, the urologists are going to, if they see the patient, and they can do a little operation and make it straight like this. Sometimes the diabetes people will have a condition called balanitis. If they are not cleaning the tips all properly, there may be some inflammation or some scarring there. And with that, also we can get problems. So many factors are here. With all these things, do you all know that normal man without any sexual problem can have about 4 to 5 good, strong erection while he is sleeping? The moment he starts sleeping to the moment he gets up, that's a good way of identifying whether he is suffering from psychological factors. This slide I am just briefly telling. Certain drugs can also create problem of erections. And I'm not going to discuss that. If one of you or some of you is having such problem, you always can consult with the doctors. There are many ways of treating erectile problems. Of course, we do have Viagra-like medications. They have some side effects, but then they are very useful, and they are the main line nowadays. There's also injections, which was before all these oral medications. The injections are still available. There are also pumps, which can be used if they don't like injection. If they cannot take oral medication, they can use the pumps. I can't see it. And some medication. The last one that you see, 3-piece inflatable prosthesis, it is for putting there permanently and with the pump. So the pump, pressing the pump, penis can get up and get down. It's when all else fail, that is the one to be used. Then another factor that can affect them in terms of ED is also the desire. If the desire is not there, whatever I spoke just now is meaningless. So there should be some desire. What introduces desire? What is important? Can you see this slide? This is a Durex company. The condom company always does surveys in Asia and everywhere. And this sometimes come in straight times once a year. Nowadays I don't see that, but it's an earlier one, few years ago. And it starts with France, Netherlands, Denmark, etc. on the top. And if you go down and see the last one is what? Can you read? Yeah. So stress may play a role, or making money also can play a role. If the share market goes down also, penis can go down, because how to think about night times. So partner relationship is very important. Awareness of sexuality, knowledge, stress management is extremely important, and particularly hormones. You have to see the testosterone level, and the professional support, going to the professional and the caring people to see. So testosterone is supposed to be male hormones, but it is also found in female and useful for female as well. Same as estrogen of the female is also found in the male. But testosterone plays a lot of things, including erectile dysfunction, reduced erectile quality, and desire, libido, arousal, all will go down if the testosterone is abnormal or lower normal. So one of the things is, if there is no desire, apart from the lifestyle factors, stress and etc., it's important to check the blood and see where the testosterone level is. Even for ejaculation also, testosterone play a role. Obese men have lower testosterone. Body mass index of 4 to 5 equals to 10 years of aging. So obesity is one of the factors we have to take care, not only for erectile problem, for all the problems. And also the abdominal fat is full of estrogen, and converting all the testosterone will be converted to estrogen, whatever left also. So the fatter the person, one can walk like this, and you know that he is having ED and he is having no desire. So that is very important for us to look at it. Even and when we go older, you see menopause, later on doctor will be speaking about menopause and andropause. Men also will have andropause, we call it, but not like menopause, not like menopause suddenly goes down with estrogen at the age of around 50. The andropause will be a slow going down of the testosterone as one is aging. But nevertheless, that erection will be there and in some of them. But if the level is very low, and they can be replaced, something called hormonal replacement. And nowadays we call late onset hypogonadism, when the testosterone level is low. And you can see here, this is one of my studies long ago from the patients. Approximately 34% of ED patients have low level of testosterone. Testosterone therapy can improve libido and ejaculatory parameters. It's very important. And in my personal experience, I'm very, very surprised. Young people do have low testosterone level, and it has been seen all the time in the clinic. So it's very important. One of the lifestyle factors to overcome this thing is also have a good exercise and have a good food and a healthy body and keep it trim. These are very important. So a little bit on the ejaculation problem. I'm left with about 5 minutes. I think they are not taking into account the MC's time, but it's getting shorter now. Ejaculation problems. Predictor of ejaculatory problem. What are the predictions? If the testosterone is low, also one can get ejaculatory problem. Spinal cord injury, when there is an injury and accidents and etc., that can create a severe anejaculations. Diabetic neuropathy, diabetic people with a neuropathy and an extended diabetes. Neurological endocrine illness, cancer, prostatic problems, all those things causes ejaculatory problems. Male behavior and their trait, the way they masturbate also can create problems in the family level, in the couple level. Masturbatory techniques, inappropriate techniques can create problem. Conscious ejaculatory control to avoid pregnancy. Consciously controlling also eventually with the wife he can't. And if he has been masturbating in a different style and when he's married and when he's engaging with wife, sometimes he can't connect that one to this and then he can't ejaculate inside the vagina, but he can ejaculate during masturbation. So many types ejaculatory problems. And I won't have time to go through everything, but I will also mention here the retrograde ejaculations. The tube over there to coming down, instead of shooting outside ejaculation, it goes into the bladder. That's called retrograde ejaculation. That is also another problem because patient will worry, hey, why I'm not getting the ejaculate coming out. Premature ejaculation is another problem. A lot of studies were done in Asia, about 15 to 30% in different countries, the prevalence percentage of men suffering from premature ejaculations. And you see, normally the sexual line here is desire, arousal, orgasm, then ejaculations. But in the premature ejaculation, men, they get the steep excitement, steep arousal, and quickly they ejaculate. So sometimes it's even when they were kissing or touching or foreplay time, he ejaculates. It's not 1 or 2%, it's about 15-20%. Big study done by all of us, including me, the international experts all, we found that men are born with premature ejaculation are called primary ejaculators. It's very difficult for them to change, and they can ejaculate within 60 seconds, within 1 minute, and that condition we call premature ejaculation by definitions, based on these studies. And the normal ones is called about 5.4 minutes, plus or minus here and there. So there are medications for premature ejaculation as well. For any ejaculation and difficult to get ejaculation, there's a lot of behavioral therapy that I give, masturbatory techniques, all changing the techniques in the man. The female side, the last bit, if I have little time, I will just quickly go through. The women's problem of sexuality also play a role because sexual intimacy is 2%. If you have a heart attack, it's a 1%. If you have diabetes, you have 1%. But sexual problem is 2%. It's 2% must click well. The lady also must have a good health and without any sexual problem. And then the man also will have to have, and then it will go hand in hand very well. Profoundly influenced by culture, the ladies are. Undergoes changes at different life stages. They go through a lot of life stages, and they are suffering in that aspect a lot more. And then childbearing and postpartum period, and then lactation period, all the desire all will be low, all those things. And nevertheless, in spite of all those things, papers all and then studies are tell sex tops happiness index for women. And the women also a bit complicated in relation to, and they have a lot of buttons, and the male has only one button, that is, he thinks about only sex. Whereas ladies needs a lot of love, intimacy, and etc. to get arousal, desire. So all these things men should understand. Some men don't even touch for foreplay. Foreplay is, they don't know what is foreplay. Without foreplay, the lady cannot be aroused and no lubrications. But the man is, some men telling, if I do foreplay, then my penis goes down. So you see, that means he is not strong enough. But here, males are more oriented. I put the word more oriented because it's not just sex alone. Men are also, most of the men are good men, one woman men. I see a lot of men are one woman men. It's not the one hunting for ladies all as what people think. No, more men are oriented sex because the genitals is open and easy and things like that. But females are more oriented for relationship, for contacts and etc. So let us see the problems of ladies. Also desire problems, arousal problem, then the vaginismus I mentioned, and the pain, dyspareunia I mentioned. These things are in certain percentage, and orgasmic problem. Orgasmic problem, invariably about one in 5 lady will have the orgasmic problem, according to statistics. So low and absent desire, no interest in getting turned on, no arousal difficulties, vasocongestion. Congestion means, like the man, engorgement must take place in the private part of the female when she is getting aroused. And lubrication, all these things are needed to be seen. So some of the disorders of desire I have mentioned here, 34% in some studies in the United States won't have desire, but again it's going to be a lot of psychological in the brain and etc., not really the organic factor, the desire issues. And the arousal issues here, and the disorder of orgasm. These are all the ladies' problems. I will give you a small statistics. Dyspareunia means the pain, and it can be psychological, also it can be biological. There may be some infection in the private parts, and they may have problems of pain, or pain can come just psychologically, screaming, and when they see the penis, and that's called dyspareunia, pain during intercourse. The vaginismus, as I say, you can see the picture there, the tightening the thigh, and that's a vaginismus, that the entire pelvic place will be just spasmic and contracted as though not allowing for penetrations. And that's a lot of behavioral therapy, lot of sexological factors, homework, etc. has to be given to overcome this problem. And one of the main factors for unconsummated marriages is ED for men and this vaginismus for women. Some of the common causes of sexual dysfunction here is unskilled and uncaring men also can be blamed. Communication problems also can create problems for the ladies. Anxiety, depression is bad, and also medication for depression also bad for desire. So this has to be, if there are, when you're taking medication, if you see some changes, then you have to consult back to your doctor. And here is what percentage of females suffer from dyspareunia? About 14%. Anorgasmia, unable to get orgasm, 24%, which is about 1/5 of the people. Pain, 21%. Inability to lubricate is about 18%. Low desire is the most common, 1/3, 33%. Whereas for the man, you can see dyspareunia. Men do have the penis, if it's a phimosis, if the foreskin is very tight, he may have some pain, but the percentage is very small. Delayed ejaculation. Rapid ejaculation, which is premature ejaculation, is 28% in this study. Erectile dysfunction, 10, but it can be more as one is aging. Pain, 8, and low desire for men is also about 16%. So, do I have time? She's checking my time. So what can turn off sex in a couple? Interpersonal conflict, very important. Please remember the last 2-3 slides. Sexual difficulties and failures, sickness, tiredness, nutritional factors. Sex become a chore, not pleasurable, then have to revive. Myth and misconception shouldn't be there. Lack of sexual knowledge. Get some knowledge from internet, books, and elsewhere. Pressure to perform, making baby, pain disorders, all these things are contributing to the turning of that sexual action. Elements of healthy relationship, dependability to husband and wife, mutual trust, understanding each other's behavior and mood. These are very important. That's why more and more I would like to see more of the men and women who are about to get married, so that they are well prepared for things and then go into the marriage. Suddenly both of them, A and Z, getting together and getting married, this problem of sexuality can come and drift them. That's why sometimes we see a lot of divorces nowadays, 3 years, 4 years, 5 years, Zoom, I finish. Have similar interests and doing things together. Modifying and adjusting expectation. Expectation is the big killer. I'm expecting this and this in my wife. I've already made up my mind before marriage. Now I don't see all those things. I'm getting angry. That's no good. So expectation must be killed. Modifying and adjustment of these things are important. Sharing history and spending more time together, all these things to improve the sexual intimacy is one of the main contributor for sexual intimacy. It's very important. And then the last 2 slides. Sexual health is general health, as I said in the beginning. General health is sexual health. No, if you are having a general health, sexual health is good, and vice versa. It's very important. Healthy diet, regular exercise, control your blood pressure if you have, control your diabetes if you have, reduce your cholesterol level, and don't smoke. The second last one, to keep a lamp burning, we have to keep putting oil in it. And that's Mother Teresa said. It means it's the same thing. You keep on putting good things to your wife, good things to your husband, and improve the bank of positivity rather than negativity. And this is also second last. Keep the flame burning. Love isn't about when you first meet. It's about the many, many years you spend together when you are trying to keep that flame burning. So let us all keep the flame burning. Thank you very much.
Thank you, Professor Adaikan, for the insightful sharing. We now have a Q&A session. Our staff are holding on to, there are 2 roving mics, and our staff are holding on to them. Please raise your hands if you have any questions. Are there any questions on the paper? Yes, we have a question.
Yes. I would like to ask you.
I think the mic is not
I would
on.
like to ask you all, since you all have requests for a question. This talk is regarding both parties. Frankly speaking, I should say, it's really etiquette for you all to talk like that. Some of us are old, an elderly person, and we don't really think about so much. The younger generation have the thought of this. What do you say? To your opinion? to rectify the whole thing.
So, sorry, would you like to take the mic?
You said as one go older and then there is no desire, it's all meant for younger people. Is that how you?
Yes, most of the younger people have the taste of this. To be frank with you, the elderly, most of them adapt themselves to elderly things. So, how would you think in such a way? And explain to us, especially the elders.
See, last time, say 40, 50 years ago, our longevity is about 40, 50 years. 100 years ago also about 40 years. Now today, if we see the obituary of Strait Times, I'm very happy to see. Most of the time I see 101 years, 99 years, 89 years. And we are getting more and more and we are beating Japan. So our time after menopause is going to be getting bigger and bigger. You see, from the age 13 to 50, you see, and then from 50 to 80 and 90, see, it is equally getting the same level. And what we say is, for language, if you want to learn a new language, you have to use it. Otherwise, you will lose it, right? Yeah. It's the same thing for sex. Surveys are telling that if husband and wife are regularly enjoying sex in the 30s and 40s, and their 50s and 60s and 70s will also be similar. Maybe the frequency is less, but the quality will be even more. Appreciation will be a lot more. So that's how the studies all are telling. It is not that I see a lot of statistical studies now from the Western world and the local Asian world. 70s. In the 70s, all couple are having a good sex, not necessarily 3 times a week, but maybe 3 times a month or 1 time a month. It's up to the individuals. But the intimacy part is there. It's not only sex, but also the plain intimacy and getting together, extra sex and etc. So it's very important.
Okay. In European countries, I should say, they are more advanced. In the Asian country, it's not like that.
Yeah, you're right.
Am I right?
It's a bit conservative, but I think things are coming out faster.
It all depends. Thank you.
Thank you.
Are there any other questions? Okay. Yes, there.
Thank you very much. I would like to share based on what this lady has said. I went to Australia to study at La Trobe University. My godfather and godmother, 70-year-old, they actually have sex every night. And my godfather is a stroke victim. He had full body paralysis for half a year, and my godmother is a diabetic. But at the age of 70, they have sex every night. Then I asked him, how do you do it? Then he told me, sex can be done in different ways. Yeah, it's about mind. And one day when he came home, and my godmom is not at home, he thought she ran away. He knelt on the floor and cried. Can you imagine? He looked like Arnold Schwarzenegger and he crying on the floor. Love can move mountains. It can melt rock hard men. Thank you.
Thank you. Thank you. If there is no question, we can do the next one.
Okay. Are there any further questions? Okay. Professor Adaikan, we would like to present you with a token of appreciation. Please pose for a photograph. Thank you.